Mhm.
But I think the bigger takeaway from this is for your colleagues that, again, are worried about, I must be there. I must be in front of that patient. The equipment we need is not a lot, right? We're talking about either it could even be an iPad on a pole. Do you tend to use a lot of peripheral technology? Do you use a Bluetooth stethoscope? Is there any other peripheral devices that you use that someone would need if they wanted to establish this program in their hospital?
Yeah, I mean, basic bladder scanners, which every
Okay.
hospital has that. That's kind of the bane of every urologist's existence. And, it lets you know whether or not that person needs a catheter or, if they can go home safely. Stethoscopes, if you really need to listen to somebody's belly, but generally they've got a bowel obstruction or something going on from a general surgery standpoint, for those sorts of things. So I think, my biggest piece of equipment is just making sure that there's a bladder scanner
Okay.
available. Because that will help you make 95% of your decisions.
And as long as you have a competent nurse at your bedside or, one of
Absolutely.
your great APPs, this really is an excellent, methodology for performing medicine.
Absolutely.
So